and that if funds were embezzled, justice be served.
The National Health Insurance Authority, NHIF, has terminated its contract with the Ministry of Education to offer comprehensive medical cover for public secondary school students. The cover, which has been in use since May 2018, covered all students from Form 1 to Form 4, and the government used to pay a premium of 1,350 shillings for every student. Beldin Waliaula brings us that story.
Now, millions of secondary students' health is in limbo after the government terminated their comprehensive medical insurance cover offered by the National Health Insurance Fund. The cover, dubbed Edu Afya, which was one of the health schemes offered by NHIF, was introduced by former regime and has been in existence for the past 4 years. The decision, effective December 31st, leaves parents and educators to figure out solutions amid the fears of potential impact on students' well-being. In a letter seen by KTN News, dispatched to healthcare facilities last month, NHIF cautions hospitals that it will not compensate them for services provided under the secondary school medical program beyond the expiry period of the contract on December 31st. The letter reads in part, and I quote, "This is to inform you that Edu Afya medical cover for students in public secondary schools, which has been in existence since May 2018, will lapse on 31st December 2023. Treatment received or claims launched after the deadline shall not be processed for reimbursement." The cover, which was adopted in 2018, is reviewed on an annual basis and renewed through agreement by the Education Ministry and NHIF. Under the cover, the ministry negotiated an annual premium of 1,350 shillings per student. The scheme offered comprehensive medical insurance coverage for students in public secondary schools registered with the National Education Management Information System, NEMIS. The idea behind the medical scheme was to reduce school absenteeism of students who otherwise would struggle with the cost of medication, and was part of the earlier initiatives of universal health coverage. The cover will also help in diagnosis of previously undetected and therefore untreated chronic conditions that could cause students to miss school regularly. The end of medical cover now raises questions on the fate of students who have chronic diseases or undergoing treatment under the same cover at the moment. This comes at a time when NHIF is expected to cease its function to pave way for the Social Health Authority, where every Kenyan is expected to be a member and contribute a percentage of their salary to it, hoping the new payment modality will reduce health inequity in the country. President William Ruto is certain that the new Social Health Authority will be the savior of the ailing medical sector in Kenya.
In the new year, we continue our health transformation at the secondary and tertiary health levels, emphasizing the need for a fair contribution system for social health insurance, as the previous setup disproportionately burdened and alienated low-income earners from accessing health care. For the first time, ladies and gentlemen, every Kenyan, without exception, will have health insurance, and all Kenyans will access treatment.
Beldin Waliaula, KTN News.
Boost for over 3,300 Kwale students as county government offers